7 symptoms of a heart attack 1 month before. Don't miss these. Hello and welcome. Did you know that every 40 seconds, someone in the United States suffers a heart attack? It's a shocking statistic, and the numbers are on the rise, especially for people under 40 and women. Over the last decade, heart attacks have become more common in younger populations, and surprisingly, 1 in 5 women are at risk. Cardiovascular disease is responsible for over 17 million deaths annually, surpassing deaths from cancer and traffic accidents combined. The scariest part? These diseases often develop silently, without giving us obvious warning signs. But here's the thing. Your body does give clues before a heart attack strikes. In fact, early warning signs can show up to a month before the event. Today, we're going to discuss 7 key symptoms that can appear days or weeks before a heart attack. These symptoms may seem like just another part of aging, but they could be your body trying to send you a distress signal. So, let's dive in. Sign 1. Cold sweat and paleness. Let's start with the first symptom that could appear up to a month before a heart attack: cold sweat and paleness. You may think sweating is no big deal. It's just your body cooling down, right? But when it comes to heart issues, cold sweat isn't the same as the sweat you get from physical activity or hot weather. Cold sweat related to heart attacks can suddenly appear even while you're resting or eating. It often comes with paleness in the skin, particularly on the forehead. The sweat feels sticky, and you might feel a chill running through your body. I've seen this in my practice with many patients. One in particular, Mr. Adams, came in complaining about feeling unusually cold even though it was a warm day. He had experienced this over the past few days, often after a meal or during his evening relaxation. Unfortunately, this was a sign of stress on his heart. Fortunately, we caught it early, and he was able to take preventative measures before anything serious happened. If you experience this cold sweat and paleness, especially multiple times, don't ignore it. Sign 2. Fatigue or shortness of breath. Now, let's talk about fatigue or shortness of breath. Now, I know you might be thinking, I get tired all the time, especially after a long day. But fatigue related to heart problems is a different animal. This isn't your regular tiredness. It's a new and profound fatigue that seems to hit you unexpectedly, even after minimal activity. For example, 70% of women who experienced heart attacks reported feeling extreme tiredness or shortness of breath just days or hours before their heart attack. One of my patients, Mrs. Thompson, an active woman in her 50s, started feeling exhausted just from walking a short distance. She'd been a regular jogger, but suddenly, climbing a flight of stairs left her out of breath. Turns out, her heart was struggling with clogged arteries, and this fatigue was her body's way of signaling that something was wrong. If you're noticing shortness of breath after simple activities, it's crucial to get checked, even if you don't have chest pain. It could be the first sign that your heart isn't getting the oxygen it needs. Now, let's move to jaw pain. This might seem odd, but jaw pain, especially on the left side, can be a signal of heart trouble. Why the jaw? Well, it's all about how our nervous system is wired. The nerves that serve our heart and jaw originate from the same area in the spinal cord. This means that pain in your jaw, particularly on the left side, can sometimes be referred pain from your heart. I've had a number of patients come to me complaining about jaw discomfort that they initially thought was dental pain. But when we examined their risk factors, high blood pressure, smoking, and family history of heart disease, it became clear that this was more than just a toothache. If you have jaw pain that persists and is accompanied by other symptoms, don't brush it off as something simple like a cavity or sinus infection. This next one, digestive discomfort, is especially common among women and older adults. It's easy to mistake heart-related digestive symptoms for simple gastritis or indigestion, but heart problems can mimic stomach issues, such as bloating, discomfort, or even pain after meals. A perfect example is Mr. Franklin, who thought he just had indigestion. He came to me complaining about bloating after every meal. However, when we looked closer at his risk factors, his age, family history, and recent fatigue, we started to connect the dots. Digestive discomfort can sometimes be the first sign of heart stress, especially if it occurs after exertion. If you've had unexplained bloating or pain that doesn't resolve easily, it could be a sign that your heart is under pressure. Let's talk about back pain, particularly pain around the scapula or lower neck area. This can be an important signal that something is wrong. Many people dismiss back pain as muscle strain, but pain that doesn't go away with movement or typical muscle remedies can sometimes indicate a problem with the aorta, the large artery that supplies blood to your body. This type of pain often occurs between the shoulder blades or in the lower neck, and if it persists or feels unusual, you should get it checked out. Aortic problems can be life-threatening if not treated immediately. I had one patient, Mr. Harris, who had persistent pain between his shoulder blades, which turned out to be a weakening of the aorta. Thankfully, we acted quickly, and we were able to prevent any severe consequences. Sign 6. Numbness in the left hand or arm. Have you ever experienced numbness in your left hand or arm, especially while doing something like climbing stairs or walking? This is another crucial warning sign. Many people experience numbness for various reasons, but when it's accompanied by other symptoms, such as fatigue or shortness of breath, it should not be ignored. I once had a patient, Mrs. Lee, who suddenly started feeling numbness in her left hand while walking to the mailbox. When we examined her further, we found that she was at high risk for heart disease. Numbness like this is often a sign that your heart is struggling to pump blood effectively, and it's time to seek professional help. Finally, let's talk about dizziness. If you've been feeling lightheaded or faint, especially during normal activities like walking or climbing stairs, this could be a sign that your heart isn't getting enough oxygen. This can happen if the arteries are partially blocked, preventing adequate blood flow. This is a symptom I take very seriously. One of my younger patients, Tom, came in for a checkup after feeling dizzy while walking up a flight of stairs. After further testing, we discovered that he had some significant blockages in his coronary arteries. Dizziness, especially when it's new or happens during routine activities, should never be ignored. So, there you have it. 7 symptoms that could be warning signs that your heart needs attention. These symptoms can appear days or even weeks before a heart attack, so it's important to stay aware and take action early. I've seen firsthand how catching these signs early can make a huge difference in preventing a heart attack. If you recognize any of these symptoms in yourself, don't hesitate to reach out to a healthcare professional. Early intervention could save your heart and your life. If you found this video helpful, give it a thumbs up and share it with someone you care about. You could help them avoid a life-threatening situation. Don't forget to subscribe to our channel for more heart health tips and information. And remember, taking care of your heart isn't just about prevention, it's about living a full, healthy life. Thank you for joining me today. Take care of yourself, and I'll see you in the next video.